In general, primary care centers will collect influenza-like illness or ILI cases, and hospitals will collect severe acute respiratory infection or SARI cases. If a sentinel strategy is chosen, some criteria must be considered in order to choose the centers that will be a part of the surveillance network. Knowing the characteristics of the centers that make up our surveillance network will be particularly useful because it will offer us valuable information about how to interpret our results. In fact, even when surveillance is universal, these features are worth knowing. There are two types of criteria to consider. First, the overall representativeness of the population served by the center. Second, the facilitating criteria for carrying out surveillance activities. As regards overall representativeness, the program should know what are the main characteristics of the population, and the center should serve people who reflect the country's population characteristics. These characteristics may be individual or social. Some of the characteristics we would consider for representativeness are different ages, sexes, medical conditions, ethnicity, socioeconomic status, climatic areas, urban or rural residents, and risk factors. Not all centers will reflect all of these criteria of representativeness. That is why it is a good practice to have different centers. Regarding the facilitating criteria, we should consider whether the centers are willing to do surveillance and whether they find it feasible to carry out the activities associated with surveillance. As for willingness, both the motivation and the skills of the health center professionals count. There is also the political will to choose and to provide resources to the chosen centers. Regarding feasibility, it is necessary to have staff who have the resources, including time and skills, to perform the surveillance-related tasks. It is also necessary to have a laboratory that is associated with the center and that has the capacity to maintain testing if there is an increase in the number of cases. Additionally, efficient data management systems need to be in place which allow timely reporting of quality data. The center in question must know its reference population, and this is important for obtaining the denominators of surveillance. Finally, previous surveillance experience can be useful, such as experience that was gained during the SARS-CoV-2 pandemic. As much as is possible, or as often as possible, the center that is selected for SARI sentinel surveillance should have an intensive care unit. In this video, we have seen the criteria to consider when selecting sentinel sites and also criteria to consider when interpreting data from the surveillance network.